So, when a patient comes to a clinic, what do we do? So, as a podiatrist, I bring the patient to my clinic room and we start with the same question, simple basic question. What's your name? What's your age? Asking a age, it's very hard question to like we judging them like after when this is 71. Oh, we don't have anything to say like, oh, you look good for your age, or whatever, you got good genes. It's just considered a rude question in Australia. So then what we do as a student, so we'll just bring the patient in and we'll ask them, how may I help you? And then they'll tell the reason what made them to visit the clinic today. So we'll start with good morning, age, and presenting complaint, and then we'll be going through their medical history, like what medical history, like diabetes, any peripheral artery disease, any asthma, or any sort of things that they had in their life or they currently been having. When people are above 60, diabetes, peripheral artery disease called PAD, cardiovascular disease, they're very common because see, you used your body for like 70-80 years, so definitely it's gonna start to retire soon, because man, even the work age, you have to retire after 60 years. So now then one more important question we ask our patient is allergies, any allergies they got, because just in case if we prescribe them something and then we completely didn't make sure that they have allergy to something, and that can be very fatal for them. And then we talk about their medical history, like what medication they own for diabetes, for hypercholesteremia, for high blood pressure, for low blood pressure, for kidneys problem they got. And then we start with medications, like how many medication are these people taking. Like in a medical field, you can't take more than 5 medication, 1 2 3 4 5. If somebody is currently taking more than 5 medication, what happens is they can cause polypharmacy. Polypharmacy is a definition that's given, like drug can interact with each other, because basically medication are a form of drug. And then when we come, like when we already are aware of medical history, like for example, person got the diabetes, and for diabetes he's taking insulin, then we consider the side effects. I am podiatrist, I will be, and then what side effect that medication can have, and that's relevant to us. Most of the medication, they cause nausea and they make the person dizzy. If they cause nausea and dizzy, what happens is increases the chance of a patient to fall, and if they fall, can develop fracture, and if they're old, oh god knows how long it's gonna take for them to heal with that fracture, because bones are already weakened with the like osteoporosis and other sort of arthritis they got in their body. And then we rule out these things by looking at the family history. What happens is when you are 40-50, you are considered healthy, but once you turn to start 60-70, your body just need an excuse to make you sick. And most of the time the condition which patients suffer, their parents are already suffering or already suffered and died of them, so they are called the risk factor of a patient to have the condition. For example, if your mom has like diabetes, high chances in your later ages you will be having the diabetes too. These are called genetics problem which you get. And then these are the family history, and then we ask about any surgeries they got, like any fracture, any like kidney removal, any like cardiovascular surgeries like coronary arteries removal or fixed, like that kind of thing. And then we ask about the footwear history. Most of the patient, they'll come to us and they'll be like, oh, their foot is sore, their heel is sore. The reason, inappropriate shoes. Most of the time they don't even want to spend the money to change their shoes, so that makes things hard for us as a podiatrist student to like actually guide them. And then we'll ask about social history. How many times do they drink? If they smoke, if they're smoking, if they're drinking, and if they're doing other stuff, definitely decreases the immune system. I'm just revising my notes because I have to present all the things when a patient comes in my clinic in front of my supervisor, and that's when they guides me, oh, that's what you need to treat. Then when everything is noted down, then we finally do physical examination of our patient. In physical examination, we examine their feet and with lower limb. What we look for is, we start with the nail. Their nails are usually hard. Then we go to hair, if they have any hair within the normal limit or there's less hair. What happens is, most people don't have hair, especially when they grow old. When you have hair, that gives the idea that blood is still flowing and that everything is happening in a normal like situation. But when they don't have hair, that gives the idea like there's not enough blood supply, and that's why the hair are not growing. And then we check for the temperature, if it's within normal limit, and or if it's cold like that. And then we check for the arterial condition, like if they got a spider web of veins on their feet or leg, then they on their, or like that kind of thing. So we check for the color change. Normal healthy looking skin is like brown, white, or whatever. But if they got like brown looking patches, that means like the arteries is leaking inside their feet and the iron is spreading, and they're giving them brownish color. Then we check for nerve supply, like how is their nervous system, like if you touch there, can they feel, or can they check, can they like feel vibration, can they feel, or like all sort of thing. I had a patient, like, trust me, she had a peripheral neuropathy, and she was baking something and the fork fell down on the thing, and she was standing there for the whole time, but she couldn't feel the pain. How strange. Those people can't feel pain, like at the one time and if we consider one situation, yeah, they're good, they can't feel pain. But other situation, she actually got burned and she can't even feel pain, but the ulcer but the wound she had, that was massive and took her like 6 to 12 months to heal. And then, so these are the things. So once everything is done, then we finally go for the treatment. If they came for like general treatment, we'll just look after their feet, and then we'll just do the regular checkup. If their nails are long, we will cut their nail. We'll check for their blood pressure, their toe pressure, all sort of thing. And if they're having foot pains, then we'll prescribe them with orthotics. Orthotics, we definitely gonna modify according to the feet structure, like which area is sore, that needs more deflection in the sense cushioning. If they have these fatty, if their feet are like that, we will try to bring that back to surface and with the proper alignment. So these are all. And when everything is done, then we give them 3 management plans: short term, long term, and medium term. Short term, medium term, and long term. Short term, what we did today, treatment, just like cutting of nails, for example. Medium term will give them suggestion: please moisturize your feet every day, don't leave them dry, they can lead to like cracks in your body or feet as well, or anywhere. And then third, weight loss, healthy diet, reduce smoking, reduce alcohol intake, have a proper weight loss journey, start an active lifestyle. These all are things a podiatrist look after for you all. In my country, there's no podiatrist. I feel like if I go to India, I probably can evolve. But how? I got no idea. I won't be opening the YouTube page channel. Bye guys.